Hey everyone, welcome to Connie's Journey. I started this YouTube channel so that I could share a little bit about my life as a wife, a mom, a business owner, and a patient living with autoimmune illness. In October of 2018, I had life-changing surgery, and I'd like to share a little bit about my journey with you. Make sure you subscribe to my channel and stay tuned. Hi guys, welcome back to Connie's Journey. We're going to talk about some great stuff today. We're going to be talking about the rectum. But I want to take a moment because you see behind me this picture on the wall that says, remember why you started? Anything that I do in life, that applies to. So whether it's a business thing, whether it's a personal goal, whether it's a health and fitness goal, I always want to be reminded of why I started my decision. So keep that in mind every time you want to start something. Remember what your why is. Okay, so moving on. I wanted to let you guys know a little bit about what my diagnosis was, why I started Connie's Journey, which ultimately was several diagnoses that I had received over the course of a few years. That made me decide I wanted to raise awareness for chronic illnesses. So last year I developed the brand Chronically Unbreakable because not only did I want to raise awareness, I wanted some way to arrange to make money so that way we can donate part of the proceeds towards research, because what I have discovered in my 8-year journey is that the funding is so scarce and there's so much unknown because there's so many different types of autoimmune diseases and so many symptoms mimic other ones, and it really confuses the doctors that they just don't have enough funding to be able to figure it all out. I'm not even sure in the next 20 years if they're going to be able to figure it all out, but right now in this lifetime, I would like to do what I can to contribute towards raising awareness and helping with some of that funding. So, going through a little bit of my history, my diagnoses have been ulcerative colitis, skin cancer, which has all been basal cell, so it's not melanoma, but it does usually require surgery. Undifferentiated connective tissue disease, which basically includes the Raynaud's that I have. If you guys don't know what Raynaud's is, it's a vascular issue, and your fingers and your toes will turn blue in the change of cold weather. And it also really affects my nose. For a very long time, it affected my nose so bad that it would make me fall asleep. I wouldn't want to call it pass out, but it would make me fall asleep. And that would be one of the ways that I would be able to recover because it would be so intense. On top of the Raynaud's, they have struggled with trying to also diagnose me with lupus, and that is why they came to the diagnosis of undifferentiated connective tissue disease. If you look that up, it is a multiple of autoimmune illnesses, which I display and have test results for a couple different ones. So aside from that, they recently tried to diagnose me with mast cell activation syndrome. I know a lot of you have heard of that. Doctors have thought maybe you have it or you have already been diagnosed with it. We are not 100% sure. They did send a lot of my blood work to the Mayo Clinic, but as some of you know, those test results, even when they come back normal, it does not mean that you do not have it. We are kind of waiting for the summer to come to see if I have any episodes once the heat becomes a lot. A lot of the symptoms that I was having was also confusing because of my ulcerative colitis being in such a bad situation. So when I went into the hospital in September, I was at 2 different hospitals and neither one of them could pinpoint exactly what was happening. My heart was not doing well. And what we kind of discovered was my heart was reacting to actually the fact that my ulcerative colitis had gotten so bad that all of my organs just started to kind of freak out. So with going into the ulcerative colitis, I basically had my large intestine removed in October, and I had one of two surgeries. I am not going to be doing the J-pouch surgery because I'm still having severe issues with my rectum bleeding. And although it's not pretty to talk about, it is a fact. And I definitely wanted to come on here because some of you who discover my channel will either be prior to having surgery or just had surgery and are not too sure what the next step should be for you. In speaking with my surgeon, we came to the conclusion that the best thing for me is for me to have part 2 surgery, J-pouch not being an option, and for me to do what's called the Barbie butt surgery. So for those of you who don't know what that is, they remove the rectum and the anus, and then they sew the anus closed, so that way it basically looks like a Barbie's butt, because the Barbie doesn't actually have a real butt. So I'm sure that's all very exciting for you guys to look and research. Basically, I am at the point now that I was hoping to wait a year to do the next surgery, but I did have a scope a week ago, and right now it's March. So I'm not going to be able to wait until October, it looks like. It looks like it's going to have to be done sooner. We are going to wait to see how the next couple of months go, and then we'll go from there. So my ulcerative colitis diagnosis brought me to having to get the ileostomy. Basically, I had the surgery, got the ileostomy, and I've been doing so great with the ileostomy. I mean, the fact that I can get up in the morning and eat like a normal person for the day is amazing. I do have some hydration issues that I think that I've kind of figured out. And so I'm actually going to do a separate video on that, just with some tips and recommendations on what works for me. So going back to the ileostomy, when I had that surgery, when I met the surgeon, I told him right away I wanted the complete total colectomy. So that meant the Barbie butt surgery at the same time. It was the very first time the surgeon had ever met me. And so I can come off a little strong sometimes. I'm just kind of one of those people where I'm like, if I know what I want, this is what I want to do. And I know that a lot of people struggle with the mental side of this massive change, and I completely get that. But one thing that I do love to do that not everybody does is I love to work, and I love my family, and I love to travel, and I have very specific things that I want to be able to do for myself. And putting myself in the position of going to the bathroom 30 times a day again and being in agony, it was just not an option for me. But after he explained, and he was so wonderful, he even drew on a piece of paper how all the surgeries would go, so I knew visually what to expect as well as verbally explaining to me. And I asked him what he recommended. And, you know, because autoimmune disease is so unpredictable, you know, you can look at somebody's blood work and say, oh no, they're fine. And they're actually not fine. And that's what happened to me for such a very long time. And so I basically was told in September on the first hospitalization, it's almost impossible for them to gauge me because my body was fighting so hard to look so strong. And I appeared on the outside like I was doing well. And from that release of that hospital day, 3 weeks later, everything had changed and everything was going downhill fast. And because this was the very first time I had a surgical consult, and this was kind of now becoming an emergency situation, and the first time that he met me and not too sure if I was a J-pouch candidate because he hadn't been involved in my case, and I had been with another medical facility for 6 years. So there's only so much that somebody can recommend, and not knowing me, of course, the best recommendation is let's maybe not recommend, you know, the place of no return, because once you have the Barbie butt surgery, there is no option to go back later on. You cannot then go get a J-pouch and see if this works. What I do know is that the failure rate for J-pouches are just too high for me, as well as getting what's called pouchitis, you know, which is inflammation and infection of the pouch, and all these other things that seem to me like they would put me in the hospital more than going through the hell of the surgery. Because I'm not going to lie, the surgery is very difficult, but You have to just take things hour by hour, day by day, and I swear to you, every day gets better. And if it's not getting better, you maybe need to rest a little bit more, and always communicate with your doctor. Anything that you see and hear on here, I am just a patient. I am not a doctor, I'm not a nurse. I do have a lot of medical knowledge because of all the things that I've been through, but it is not because I am in the medical field. So definitely, if you end up having the surgery, you will start to feel better, you will do better. You have to figure out what works for you. People can make recommendations, but it doesn't necessarily mean that all recommendations are gonna work for you. It's really just gonna be trial and error. And nobody knows this disease better than you and me, because the doctors are basically confused with a lot of what happens because everybody has a little bit of a different experience. So you really have to kind of hone in on what's working for you and keep a diary of it, you know, whether it's food, whether it's hydration. Definitely make sure that you know all of your options. And if you are in the emergency situation like I was, and you feel like you're 100% sure just to do the total process, if I had to go back now, I'm still on the fence, because you don't know what it's going to be like to have an ostomy until you actually have one. And so I think that the fact that the doctor recommended that I do this in 2 steps was probably the best recommendation. Even though I know how I am, it doesn't change the fact that it allowed me 4.5 months to get used to having it. And I am completely fascinated with my little stoma Lola. And I look forward to doing a bag change, except for when I'm really tired. Then I'm like, oh, I have to do a bag change. And I'm like, okay, I need to do it. But guess what? I look at this and it's just amazing to me how far we've come in life to be able to still function and have your intestine outside of your body. My dad went through a heart transplant, and to me that was amazing in itself. And so unfortunately he passed away, but he did get another 7 years because of that heart. And I'm sure he was a scientist, so he would be fascinated with what's happened with me. Because it really is just truly fascinating, and for the fact that it has given me my life back. I'm able to work, I'm able to enjoy my family, I'm able to actually go shopping, which I finally got to do. So there's just so many things that I was really house ridden. It was almost like I was in prison, but I was so focused on work and goals that I had written for myself that I just kept on that, so that way I wouldn't feel sad or depressed. I kept thinking that, okay, I'm going to pull through this, I'm going to pull through this, but I believe the disease runs its course, and you all get to some point where it's rode its course, and you just cannot get better enough. And so it's different for everybody. The amount of years, it depends on when it all started for you. I don't believe in going by the diagnosis date, because I think with everybody I've spoken to, the symptoms had came on long ago, and it's not until it's so bothersome and it's affecting your quality of life that usually you speak up about it, and by then you've already been dealing with it for years. And so I basically want you all to know that my next surgery is to do the Barbie butt surgery. We did discuss us just removing the rectum and part of the anus and leaving a portion of it so he doesn't have to sew it closed, which would allow me not to have that extra wound to heal. Because I of course was like, well, I just want to work again. So how fast can I get back to work? And so what can we do? And talking about it with my husband, he wants me to do the entire surgery, because if we don't do all of it, I'm leaving myself a small chance for rectal cancer. And it doesn't usually get found in the early stages because of scar tissue. It could be found in the later stages. And the fact that that's part of the risk is probably not more important than me getting back to work. So, well, getting back to work is not more important. So I need to really think about that and do what's best for me and my longevity and in the long run, not necessarily in the short term. So I'm able to work laying down on my computer. So I technically still can work. I might not be able to drive in the car, but I can still work. So I have to consider that and consider what's going to be best for my future. In getting into the rectum situation, I have been miserable in that area. Steroids don't work for me. They make me go through psychosis. And I'm talking about crazy lady times 10. Not acting crazy like I'm mad or I'm aggressive and all of that, but the thoughts, the things that happen is just absolutely insane. And that's pretty much the only option for me right now, or the Lialda. And the Lialda is what put me back into the hospital, and my liver and my kidneys and my heart were all not doing well. So we can't try that. So I'm gonna see, you know, how the next month or so goes. I'd still like to make it to October or even the following February. That's my wish, of course. But I'm gonna do what's medically necessary, and whatever my surgeon says, I'm absolutely gonna do, because the longer you leave the disease flaring and bleeding, you're at risk for cancer. And so that would be ignorant on my end to just be like, oh no, I wanna work longer. It's like, you know what, maybe I just need to get it out of the way. So I know a lot of you are gonna be having the surgery or just had the surgery, probably in the same boat as me, had the colon removed, the ileostomy is placed, you still need to do the Barbie butt surgery. It's not an easy decision. Definitely, I don't blame you for taking time to think about it. I definitely feel like I'm still thinking about it. I think I know what I want to do. And then the next day, I'll be like, okay, well, let me think. No, I'm going to do the other way. I'm not going to close the anus because, you know, I just want to recover faster. And then I go back to, no, I don't want to be left with the chance of cancer. So I want to just go ahead and get it all done. So I need to think about my long term, which means I'm probably going to do the full Barbie butt. And if I decide that I don't want to, I want all of you to come on here and tell me, no, Connie, you need to do the Barbie butt because your health is more important than working. You can always work. But I love to work. I mean, it doesn't even feel like work a lot of times for me because I'm so excited to do it and I'm just a strategic thinker. And so, you know, getting the chance to do that is for me, it's everything. And when you're in that tremendous amount of pain, your thoughts don't work as fast. Well, my brain works pretty quick, so it doesn't work as quickly for me, and then I start to get a little bit frustrated. What I do know is that I would be going into this surgery healthier than I did the last time. The last time I was in really bad shape. I was eating 2 breakfasts, 2 lunches, 2 dinners, and snacking in between. I mean, I was eating an enormous amount of calories and I was still losing a pound every single day at least. And I was just crashing. I had a lot of muscle loss. I had to walk with a walker afterwards. I could barely walk at all, even with the walker in the beginning. I mean, it really was a struggle. And so this time I'm supposed to be going in healthier. My fingers didn't work properly, so I normally type very fast. And I wasn't able to do that. And I was having to go like this. And then whatever I would tell, you know, my brain's telling my hand to type here. It wasn't working properly. My hands weren't working right. The muscles in my legs didn't want to let me walk. It was very hard for me. So I am a little excited that I'm supposed to be healthier going into this surgery and I shouldn't have all those complications and have to rehabilitate myself so much. So that should help with the recovery process as well. My doctor says within 2 to 3 weeks of the surgery, I should be able to fully work, not necessarily sit on my bottom. So any of you have had the surgery, I already know because we've talked about it. But I would at least be able to do a full day's worth of work sitting in a certain position. So, but he did want me to try to take a time out for 2 to 3 weeks because it is a very big surgery and it's an additional wound on top of the last surgery. Also, they think I have a hernia where the stoma is. And so he's going to do a hernia repair there as well. And then God knows what else he's going to find when he's in there, because another one of my diagnoses is endometriosis. So I stay on the Depo-Provera shot, so that way I don't have any of the symptoms. And when I'm due for my shot, I start acting like a crazy person. I'm like, I need the testosterone. So once they go in there to do the surgery, I don't know if they're going to end up finding any lesions that they have to remove or anything like that. I do know that there might have to be some type of partial or full hysterectomy. It really just depends once they get down there to see what needs to happen. So, of course, it could turn into more. That's what happened on the actual original surgery. It was supposed to be 3 to 4 hours. It was about 7 hours, because he actually had to go in and repair a different hernia that I had, and then discovered that my appendix needed to be removed. And so they ended up having to do that before they could even start the surgery to remove the colon. So when I woke up that night and it was 10 o'clock, I'm like, oh my God, what happened? And they were like, oh no, he didn't even start for a couple of hours. And I'm like, what? I'm like, they put me to sleep the second they took me in there. And so then I asked what had happened, and then I started to find out that they had to do more than they had planned, which could happen on the next one as well. So always got to be prepared for that. And so I just wanted to come on here and let you guys know a little bit about the rectal issues. They're not pretty. I mean, I wish I could have a picture right here. Maybe I can insert one that's like fire, because that's what it feels like. And it's very uncomfortable. And there's times that it's affecting my bladder, and my bladder doesn't want to work because everything is so inflamed, that I felt like I was going to have a baby. not out of me vaginally, but rectally. I was like, I kept going to the restroom, and I told the doctor, I feel like I'm like about to give birth to a baseball or something. And he just kind of explained to me that because it's all part of the pelvic floor, there's several organs there. If you guys want to look that up, the pelvic floor has several organs, and all of those organs, rectum, vagina, or uterus, bladder, they're all there. So they all kind of get affected and inflamed from the situation. So that's basically what I've been experiencing. And I don't want any of that anymore. So I'm going to move on to the Barbie butt surgery. And if you guys have any questions, feel free to message me directly. Don't forget, remember why you started. Thanks for watching.